To me, diversity is essential in every walk of life. We just all do better when we have the influences from all areas and all cultures.
If you look within the business world, they've looked at diversity, and they've looked at how diversity has increased the profits, it's increased innovation, it's not your homogeneous thought process. You're bringing different people to the table.
When we actually have diversity in medicine, the patients are more likely to respond positively to those physicians or practitioners who have a cultural affinity, a cultural relationship.
Up in the sky, I can see the whole world tonight. You make me believe it's real. It's high up above from the ground.
The survival rates for cancer, which is the area that I specialize in, for Black women compared to white women, is just stark.
There's a large underrepresented community here in St. Louis. It's important that we make this a priority.
It's not enough to just talk to patients about, hey, this is the surgery we want to do for you and these are the possible complications, but it's important to do kind of comprehensive evaluations about, like, hey, will there be somebody at home that'll be able to help you after the surgery?
WashU University is really on the forefront of actually addressing healthcare for those who are vulnerable or disadvantaged.
The Department of Surgery is addressing disparities in healthcare in the North County area on two fronts. One, we are engaging the community in educational programs. We're also bringing in the faith-based community as a means to reaching the people. And then by building our cancer center in the Siteman Cancer Center in North County, we were able to bring the access that is sorely needed.
We're working with our health departments, particularly in this era of COVID, as we address how to dispense care, how to address those vulnerable communities who are most susceptible to COVID infections.
And so the Department of Surgery has really developed programs in all of these communities where we are trying to reduce disparities and improve health equity.
Before we ask others to increase diversity and inclusion, we have to look among ourselves as administrators, as senior administrators. And over the past 2 years, we really have been pioneers in recruiting the first African Americans as department chairs in both OBGYN and emergency medicine, and then one of the first Latino department chairs.
I think that we've done an excellent job at recruiting a diverse residency class, and we need to focus on being able to recruit a similarly diverse faculty.
As Black physicians and surgeons, there are very few of us. We're still very low percentage of faculty in medical schools and academic medical centers, but if we can describe what it is and how we got through the process and encourage other faculty to understand some of the obstacles and challenges that we face, I think that that's really important.
And I think with diverse leadership, we will encourage diversity in the tiers going down from college to medical school to residency and beyond.
We have an opportunity as a profession to improve our diversity, improve the pipeline of surgeons of color to represent the population in the United States.
I think that we've done great work towards ensuring that surgery is a place that welcomes people that are different, and it benefits our patients because we are, they can see themselves reflected in the care providers as well.
I talk all the time about who am I going to pass the baton to. We really need to develop and cultivate the next generation, and this is part of why I'm so excited that Washington University is hosting the Society of Black Academic Surgeons.
St. Louis is the home of the Homer G. Phillips residency program, which trained a significant number of African American surgeons in the earlier years. Even though it's no longer in existence, I think coming home as a sort of a homecoming for these surgeons who may have trained here, I think it's a historic, actually, event to come to a place where so many surgeons have trained.
Once again, it has been an honor and a privilege to host the Society of Black Academic Surgeons. And I would recognize that each of you spend much of your daytime in your day jobs taking care of patients, performing research, and developing innovative educational programs. But I would suggest that all of us have actually a fourth mission, and that mission is to improve the diversity of our departments and our department's leadership, as well as to improve the health equity of all of the patients that we serve. If you think about it, all of us, if we work together with the American College of Surgeons, with the Society of Black Academic Surgeons, and departments like here at Washington University School of Medicine in St. Louis, if we all band together, we all work together, we actually will be able to impact nationally the diversity of our physician and surgeon pool, but also improve the health equity of all of the patients we serve. I would say that is a vital mission and one that we look forward to working with all of you to accomplish.